Remember to always wash your hands before and after handling your ostomy appliances. Wet your hands with clean running water, warm or cold, and apply soap. Rub your hands together to make a lather and scrub them well. Be sure to scrub the backs of your hands, between your fingers, and under your nails. Continue rubbing your hands for at least 20 seconds. Need a timer? Hum the Happy Birthday song from beginning to end twice. Rinse your hands well under running water. Dry your hands using a clean towel or air dry. Before we begin, make sure to have all of your ostomy supplies at hand, including scissors, if not using a moldable wafer, a felt marker, washcloth or towel, tissues, a wafer or skin barrier, and pouch, and any accessories recommended by your healthcare professional. Stomas come in many shapes and sizes, so it is important to choose the wafer and pouch that is right for you. Take the stoma measuring guide, place it over your stoma. Measure the widest part of the stoma, like this. Remember that your stoma will continue to shrink for approximately 6 weeks after surgery. When using a moldable wafer, use the exact measurement size of your stoma. For a cut-to-fit or pre-cut wafer, you want to choose a size that has an 1/8 of an inch or 3 mm gap around the stoma. If you recently had your surgery, it is important to measure your stoma each time you apply a new pouch. The skin around your stoma, called the peristomal skin, should look and feel like the rest of the skin on your belly. It should be clean, rash-free, and not itchy. Your skin may be a little red after removing your wafer, but this is normal and should go away within several minutes. If the skin around your stoma stays red or has a rash, contact your doctor, ostomy nurse, or call the ConvaTec Customer Interaction Center. Before applying a new ostomy skin wafer, it is important to wash your skin thoroughly with warm water. Don't worry, water will not hurt your stoma. After washing your stoma, make sure to dry your stoma well by patting a dry towel all around the stoma. Slight bleeding of the stoma is normal. For extra skin protection, your healthcare provider may have recommended AllKare protective barrier wipes. These wipes provide an extra layer of protection between your skin and ostomy appliance and are meant to be applied after washing your skin. To use, simply wipe the skin around your stoma and allow the liquid to dry completely. Then continue applying your wafer and pouch. These are not recommended if you have a rash or open sores around your stoma. To help remove the ostomy appliance, your healthcare provider may have recommended AllKare Adhesive Remover Wipes. These wipes can be used to aid in removal of the pouch and adhesive residue left behind. To use, simply wipe the adhesive remover between the skin and the wafer, gently peeling the wafer back while continuing to wipe. Make sure to clean your skin after using the wipe to remove any excess oils left over. These are not recommended if you have a rash or open sores around your stoma. To cut your wafer to size, trace your stoma size onto the center of the white release paper on the back of your wafer. Use the scissors to cut along the outside of the tracing. Remember that cutting an incorrect size can lead to leakage and skin irritation. Since your stoma will continue to change over time, getting the closest fit will give you the most effective results. Use paste to fill in any gaps. After you have cut your wafer, use one finger to smooth the inside edge of the adhesive. To apply the wafer to your skin, remove the release liner from the back of the wafer. Do not remove the release liner from the tape, and center the opening over your stoma. Hold the wafer onto your skin with the palm of your hand for 30 seconds. The body heat from your hands helps the wafer stick to your skin. Peel the white release liner from the tape border and press gently against your skin, smoothing out any wrinkles. To apply the pouch to the wafer, Separate the inside front and back panels of the pouch so that the pouch contains a small amount of air. Position the pouch flange over the wafer flange. Gently press your fingers around the flange area, starting at the 6 o'clock position, and move your fingers towards the 12 o'clock position. You will hear and feel clicks as the pouch locks onto the flange. Make sure to check that the pouch is completely locked to the flange. Make sure to wash your hands thoroughly. Many ConvaTec pouches have an integrated charcoal filter designed to release and deodorize gas while preventing liquid from leaking through the pouch. The filter is located at the top of the pouch. Make sure to cover the filter opening with the filter covers provided in your package prior to any water activity such as bathing, showering, or swimming. Before removing the filter cover, make sure that the pouch is dry. To close the InvisiClose tail closure, roll the tail up 3 times and lock by pressing the closure strips together. For added protection and comfort, you may also fold the tail into the locket pocket, as shown. Remember to empty the pouch when it is 1/3 full. To drain the pouch, make sure to be near a toilet or other receptacle and have tissues on hand for cleanup. Unfold the tail from the locket pocket as shown, and while positioning the pouch over the toilet, disengage the closures and unroll the tail. Hold the tail up as you unroll it. This will give you more control. The white strip at the bottom of the pouch helps open the pouch tail. Squeeze both sides of the strips as shown and drain the pouch. Use tissues to clean the tail. Make sure to wash your hands. Closed-end pouches are designed to be one-time use only and disposable. When the pouch is 1/3 to 1/2 full, remove the pouch by grasping the top tab of the flange with one hand while holding the skin barrier against your body with your other hand. Gently peel the pouch from the wafer. Discard the pouch. You may want to use a plastic bag with a zip closure for disposal. Apply a new pouch and make sure to wash your hands. To remove your wafer, gently pull the wafer down away from your skin while supporting the skin with your other hand. Wipes can be used to aid in removal of the pouch and any adhesive residue left behind. Clean your skin and mold or cut and apply a new wafer. Make sure to wash your hands when finished. Your healthcare provider may have recommended Cohesive seals to help fill in uneven areas around your stoma to prevent leakage and to protect your skin. To apply, make sure the skin is clean. Remove the release paper from both sides of the seal. Shape or stretch to the size of your stoma. Then, place the seal on your body and carefully mold it. You want the fit to be snug around your stoma. Then continue applying your wafer and pouch. You can also break the seal into smaller pieces and roll or mold to fill in gaps or folds. For additional skin protection, you can use a small amount of Stomahesive Paste to fill the gaps between the wafer and your stoma. Apply a thin ring of Stomahesive Paste to the back of the wafer, closest to the opening of the hole. Do not spread the paste. Allow paste to sit for 1 minute. Then continue applying your wafer and pouch. This varies based on type of ostomy, type and amount of stool or urine, and your general body shape where the wafer is applied. In general, most people change the wafer twice per week. Always change your ostomy system if you experience leakage. It's always important to recognize when you might need medical attention. Always make sure that all of your healthcare professionals are aware that you have an ostomy. If you have any of the following symptoms, call your healthcare professional, doctor or ostomy nurse immediately. Diarrhea that lasts more than 1 day. Severe bleeding from the stoma. Stoma color turning black. severe abdominal pain, bloating, or fever. Leaking fluid from around the stoma, not through it. A bulge around the stoma. This could be a hernia. A hernia is when abdominal organs begin to poke under the skin through the abdominal muscles. You may also need to call your doctor, ostomy nurse, or CIC if you cannot get the wafer to stay on. You have a rash or open sores where you put your wafer. After watching this video, you still have questions of how to care for your stoma. Adjusting to an ostomy takes time, and you'll have questions and concerns along the way. Your doctor and ostomy nurse can help answer them, so can the healthcare professionals at ConvaTec. You can talk to an ostomy nurse at the ConvaTec Customer Interaction Center if you have questions about ostomy support or products, need information, or would like to order free samples, or even to check the status of a starter kit. Just call 1-800-422-8811, and the ConvaTec Interaction Center can address your needs. Inspire is an online support community where you can connect with other people living with an ostomy who understand what you're going through. ostomy.inspire.com. Join today, and you can connect with others living with an ostomy, access ostomy information and resources, discuss your health in a safe, privacy-protected environment, find emotional support, and help others. It's free and just takes minutes to join.